All right, joining us now, 2020 Democratic presidential primary contender, Senator Michael Bennet of Colorado, and Republican Senator Bill Cassidy of Louisiana. They are leading a bipartisan effort in the Senate to pass legislation aimed at protecting patients from unexpected medical costs. So let's start there. Senator Cassidy, I'll start with you. What does the bill do? I think it has three points to it.
Well, the bill recognizes the principle first that the patient should be the reason for the care, not an excuse for the bill. And if there's a dispute between the doctor and the insurer, you have an automatic, okay, let's go to the average of what is paid. But if for whatever reason that is not satisfactory to either party, it can trigger into arbitration. That said, the patient is taken out of it. She is not getting a bill for, oh my gosh, tens of thousands of dollars. No, she gets what she would normally pay for an in-network rate. And we do focus upon those docs and providers who are out of network, who are non-elective. You go to the emergency room, you can't choose your doctor. The pathologist and the anesthesiologist. So we think we get it.
Michael Bennet, jump in. Where else do you see this bill really having an impact? I know this is an issue that's very important to you.
It is, and I'm so pleased to be doing this with Senator Cassidy, who is actually a doctor, so he understands what we're trying to do, which is to protect Americans from getting a surprise medical bill when they're out of network after an emergency. 15% of people that are treated in this country end up with a staggering bill because it's not in their insurance network, and this just says that's not going to happen anymore. We're going to say that doctors can charge and insurance companies can charge the median bill when they're out of network for emergency treatment or other treatment. And I think we've actually worked very well together to create support outside of this place for this bill, and we actually have a chance of passing a bipartisan bill around here, which is a rare and welcome occurrence.
Senator Cassidy, being the Republican, I want to know, how do you think how the president will react to this? I mean, we hear a lot about bipartisan talk, but we don't see it through fruition. And will this bill, if it makes it to the president's desk, will he sign it?
I think the president will sign it. The president is clearly concerned about surprise medical billing. He clearly is concerned what I call those, okay, the families around the kitchen table, what impacts them, and this is what impacts them. Michael and I would both agree, this is not a Republican or a Democratic issue. It is that kitchen table issue, and I think the president's going to be with us.
So, Senator Bennet, as you know, I'm kind of slow. So I want you to break this down for me in plain English, okay? I go to the emergency room.
Right.
I need a quick outpatient surgery done. It involves an anesthesiologist. I have Blue Cross Blue Shield.
Exactly.
I leave, I go home thinking, oh boy, that was great, and my insurance covers. And then 3-4 weeks later, I find out the anesthesiologist is not covered under my health plan. Who gets the bill? What do I do about the bill when I get it?
That's exactly it. You get the bill, and because it wasn't Blue Cross Blue Shield, it was, a Kaiser doctor, let's say, you end up having to pay full freight. I just had prostate cancer, as you know. It cost $94,000 to have that operation. I was covered by insurance, Kaiser, and it cost me $1,800. If I were out of network and in the hospital for an emergency, I could have easily been liable for that bill. In fact, every single day in this country, that's what's happening to Americans, and I think Senator Cassidy and I just think that's totally unfair, and that's what we're trying to fix.
And under our system, the patient would only be billed that which would be in network. So if the anesthesiologist is out of network, then the anesthesiologist would receive from the patient that which the patient would pay for an in-network case, but from the insurance company would either receive the average of what is normally paid an anesthesiologist, or they could go to arbitration.
All right, Senators Michael Bennet and Bill Cassidy, thank you both for
Thanks
working
for
together
having us.
and for being on the show.
Thanks.
Yeah, still ahead, the White House